Imagine how Professor Per-Ingvar Brånemark felt when, during an experiment, the titanium inspection chambers he had inserted into the legs of rabbits could not be removed. The university researcher on a tight budget was crestfallen. His future as a researcher hung in the balance.
At that time, it was a nuisance, a real nuisance, because they were difficult to manufacture, quite expensive, very sophisticated optics, and we couldn't get them out. And when we tried to get them out, we destroyed them. So for a couple of years, we felt that was really a drawback of the system until, because of our collaboration with the clinical colleagues, we understood that this might eventually be more important than the vital microscopic technique that we really aim to develop.
Having both MD and PhD degrees, but no dental certification, this very resourceful man we have come to know as P.I. Brånemark was on the cusp of a discovery that has transformed modern dentistry. He created the first titanium dental implant and coined the term osseointegration to describe the process by which bone tissue fuses it in place. His energy and passionate dedication to science and the welfare of patients was infectious. He had a marvelous sense of humor and a rare compassion for his fellow man. He was also an animated, compelling speaker.
I strongly believe that we owe that to the patient. If we can do it, we should do it. Even if it's painstaking, it takes more time, we have to be more precise and more considerate. We should do that. At least we should tell the patients what is possible and what the consequences might be if we do not stick to the limits set by nature and by biology.
With the devoted support of his surgical assistant Barbro, P.I. struggled to convince the medical and dental establishment that living tissue could be fused into titanium. Even after the success of his first dental implant, performed on 34-year-old Gösta Larsson in 1965, he encountered tremendous hostility. With a cleft palate, a deformed chin and jaw, and no teeth in his lower jaw, Larsson was resigned to a life of constant pain and discomfort that left him barely able to eat and talk. The operation giving him 4 titanium implants transformed his life and allowed Mr. Larsson to enjoy a long and happy life. It took Dr. Brånemark more than a decade to gain official acceptance of his implant method as a bona fide treatment.
Titanium is a very peculiar material. Depending on the composition of the bulk, which has to be as pure as possible, how the oxide is formed on its surface, which is an inevitable event.
Because of his perseverance, titanium implants have spread well beyond dentistry, and osseointegration is now also used in medical and veterinary applications. In May 1982, Professor Brånemark came to Canada at the invitation of Dr. George Zarb, whose team at the University of Toronto had conducted replication studies. The late Dr. Daniel Sullivan, who attended that first symposium, remarked, "I was stunned by what I was seeing because I could see the impact of it." He had been used to seeing implant success rates of 60% or lower, and Dr. Brånemark was reporting success of 95%. 5 months after the Toronto Symposium, Dr. Sullivan and his oral surgery colleague, Dr. Paul Krogh, placed the first U.S. titanium and osseous implants in Bethesda, Maryland, with P.I. at their side.
We then put in 4 implants, and that was in '82, and we got the bridge placed, and it is still functioning after 30-some years.
Word of their success spread, and Professor Brånemark had soon established training centers across the United States. One of Professor Brånemark's strongest supporters was Dr. Tom Balshi of Fort Washington, Pennsylvania, who named his practice P.I. Dental Center.
In the early years of the Academy of Osseointegration, a group of us decided that we should have a foundation, and it was spearheaded by the charitable contributions that P.I. Brånemark made to humankind.
I had the privilege of being asked to dance by Professor Brånemark, and I got up from my seat with butterflies in my stomach. But just like everything else that P.I. did, he was also a wonderful dancer. and we spun across the floor as if we had ice skates on.
Professor Brånemark was closely associated with the founding of the Academy of Osseointegration in 1985 and became its first honorary fellow in 1989. His last appearance on an AO annual meeting platform was at the collaborative meeting in Boston in 2003, where his address sparked a thunderous standing ovation.
If I could use one word to summarize Professor Brånemark, it would be the word compassion. Compassion is, we often use that word, but specifically what that means, it is an awareness of and sympathy for another human being suffering, and then wanting to do something about it.
He was not only a contributor scientifically, but he had a love in his heart for people and for science and for growth of things that would help mankind, and he just jumped right in there, and in different ways he would attend meetings, he would meet with people, he would make his contribution toward the Academy because he saw that it was a good thing.
P.I. Brånemark was like the Pied Piper. He played the musical instrument that everyone loves to listen to, and it just drew everyone to him. The interesting part about P.I. Brånemark is that once the people got there, they didn't stop listening. And I think that's really what made him unique. He had a message to give to the world of dentistry, and people listened.
If anybody had the opportunity to hear him, first of all, he was hypnotizing because he had a delivery style different than most people. Even the way he dressed, even the way we always used to laugh because his bow tie was sideways, his jacket was off to the side. But once he spoke, I mean, you were hypnotized. Standing ovations were normal for him when he lectured.
I absolutely do remember the first time I met him. I didn't really spend much time with him one-on-one during the almost 3 weeks, except for 15 minutes. And in those 15 minutes, he was one that could look right in your eye and almost see your soul.
He really had a knack for seeing through a person. And I say that because he was able to see through me very quickly.
He was a tough guy. You know, he wasn't the kind of guy that was intimidated. To know him, he was, you know, I always used to say, he used to come by me, he'd say, "Hi, Burton," he'd give me a bang on the shoulder. I thought my shoulder was coming off, you know.
There's not any one small collection of things that will describe his body of work. It's a tremendous contribution to mankind.
There would be no Academy of Osseointegration without Dr. Brånemark, and that's just a fact.
Most of the things that he taught us, I still think about every single time I treat a patient.
Sometimes it takes a remarkable person. A person who probably comes only once in a generation. Someone who imagines things that other people can't imagine. And in our generation, that person was Dr. P.I. Brånemark.
If we tried to do what he taught us to do and treat patients the way he wanted us to care for them, we can all feel that he's looking down on us and smiling, and we should probably look up and say, "Tack så mycket," which in Swedish means thank you very much.